Hi, I'm Dr. Craig Laux from the Orthopedic Centers of Colorado. I sit on the board of directors, and our board of directors, our administrative team, the entire staff and all the providers have been working hard to create protocols during this COVID-19 crisis to make sure that you and your loved ones are safe during this unusual time. Over the next few minutes, this video will cover some of the things we're doing in clinic as well as the surgery centers to make your elective surgery as safe as possible. At Orthopedic Centers of Colorado, we have over 80 surgeons and over 400 employees, and we're spread across the Front Range. All of our divisions are taking the same precautions, and we're trying to make this a standardized protocol so that it's completely safe in each and every division of Orthopedic Centers of Colorado. So let's talk about some of the steps that we've put in place to make things as safe as possible for you. Everyone's talking about masks. What do masks do for you? Well, there's different types of masks that you can wear. In general, a simple cloth mask or anything that covers your face and nose has the benefit of lowering the dispersion of some of the particles that exit your mouth and nose. The way to think about it is when you cough or sneeze, all those air droplets stay contained within the mask and reduce the risk of those droplets getting out into the environment and potentially infecting someone if you happen to be infected with the virus and you don't even know you're infected. So it helps to reduce the spread to other people. A simple cloth mask, however, doesn't protect you. When healthcare providers are taking care of patients that are potentially infected or are infected with COVID-19, they need a special type of mask. Those types of masks are typically respirators like this one, like the N95. It has a tight fit to your face. It seals completely around your face, and it's got a filter that will filter out virus particles. So it actually conveys some level of protection to the healthcare provider who's wearing the mask. Now, it may not be feasible for every patient, every person to wear one of these. So in our offices, we're asking everyone to come to the office with some type of mask to help reduce the spread of the germs. And then our healthcare providers will wear these if they feel it's necessary, depending on the clinical scenario and the setting. So that's how masks work. In general, if you're going out anywhere, you should have a mask on. You're just helping the fellow community members to reduce the risk of spreading this virus because the virus can hang around for a long time on the surfaces. We're learning more and more about this as we go, but masks are a very important part of the process. Let's talk about spacing and social distancing. The reason we expect people to stay 6 feet apart is because the further apart you are, the less likely that there's aerosol droplets that can get on a surface or touch you and infect the patient. So in our clinics, we have the waiting room designed so that everyone is at least 6 feet apart. You'll see X's in front of the chairs that you can sit on. We're limiting the flow of patients in and out. We've increased the length of time for our appointments and reduced the number of patients that we can see on a daily basis. We're also staggering the start and finish times of our clinics. All of those things are done to reduce the number of people that need to be in one place at the same time. In addition, we've instituted a restaurant pager type system that will vibrate and chime when it's your turn. We've created a virtual waiting room. That virtual waiting room will allow you to come to our office. We will check your temperature, check you in. Everyone gets a temperature check. Everyone needs to wear a mask. We will do some screening questions and ask you if you have any symptoms, flu-like symptoms or any illness symptoms. You may be asked to reschedule. After we take your temperature and check you in, if there are not adequate seats in the waiting room that are spaced out at least 6 feet apart, you'll be handed one of these restaurant pagers. You'll be able to wait outside, get some fresh air, wait in the car, wherever you feel it's appropriate, and then we will page you when it's your turn to come up and be placed in a patient room. In terms of rigorous cleaning, you'll notice as soon as you walk in our office, we're going to ask you to wash your hands with an alcohol-based hand wash. In addition, you'll notice that our staff is routinely cleaning every surface in the office. We have medical and industrial strength cleaners to clean every surface in the office that you will touch, including chairs, exam tables, x-ray equipment. All the personnel will be masked up and you'll see us washing our hands frequently. So we're going to do everything we can to make this as safe as possible for our patients.